Welcome to The Bridge, from surviving to thriving in medical school, a medical student podcast on success and belonging at UCSF. This series explores how medical students succeed and thrive in medical school through important relationships, academic support, well-being, and career exploration. I am your host, Nikai Corral, a second-year psychiatry resident in the UCSF School of Medicine. Choosing a specialty can be one of the most exciting and stressful experiences in medical school. In today's episode, we will examine how students identify their career values, explore options, and choose a specialty. I would like to introduce two special guests in this episode. Kendall Islam is a fourth-year medical student in the UCSF School of Medicine, and Dr. Brent Kobashi is a professor in medicine and director of the Career Advising Program at UCSF. Kendall and Brent, thanks for joining us.
Thank you for having us.
Really excited to be here.
Wonderful. And starting with you, Kendall, what is one thing that you would like our listeners to know about you?
One thing I would like the listeners to know about me is that I really love teaching. That's something I've loved since I was little, and I used to have my younger siblings pretend to be my students, and that love has persisted, and I'm hoping to make that a part of my career in the future.
Well, you will have plenty of opportunities to do so in residency. And what is a role in the School of Medicine that gives you joy?
Continuing on the teaching theme, a role in the School of Medicine that gives me joy is being part of the peer teaching program. I am both a peer teacher and a coordinator or a leader in the program. And so my roles involve direct teaching with students, which allows me to meet students from other classes, particularly the first-year students. And the role as a coordinator allows me to mentor new teachers in the program and build relationships across multiple classes, which I love.
And Brent, what is one thing that you would like our listeners to know about you?
Something that I say during the initial orientation phase of medical school, and it might have changed, Kendall, since you were beginning medical school, is that I did not believe that I could have this job and this role when I was growing up. When I was a kid, I was not aware that there were any gay or queer doctors, any gay or queer teachers, or any gay or queer parents. And somehow I have become those things. So I can understand how some students feel when they're entering medical school that there's not necessarily a clear pathway forward. I've experienced that myself.
And what is a role in the School of Medicine that gives you joy?
Mentoring. I have several roles. I'm one of the coaches. I also do this career advising position. So I talk to a lot of people, and some people have challenges that I know very well from personal experience. Some people have issues that come up that I have never experienced myself. And it's really incredible to see people succeed and thrive.
And pivoting a bit, Kendall, my understanding is that you are applying into internal medicine.
Yes.
What factors influenced your specialty choice, and what, if anything, would you have done differently in hindsight?
I think a lot of factors influenced my specialty choice. I was originally interested in neurology coming into medical school based on family experiences, and I was leaning toward pediatric epilepsy. And then I got to medical school and realized that after exploring neurology, I really liked it, but I also liked a lot of other things. And so I realized I wanted a field that gave me a lot of variety clinically. Then I pivoted toward emergency medicine. I was in the ultrasound elective and loved that, and realized that I was really thinking about my patients after they had left the ER, after doing some rotations in the ER. And so I realized that I also wanted a field with a lot of continuity in addition to variety. So I would say extracurricular experiences like the POCUS elective, the ultrasound elective, rotation experiences like my core clerkship rotations, and then talking to mentors. All of those were really important in influencing my specialty choice for internal medicine.
Can I push you a bit on that? What is it personality-wise that brought you into that space?
I really started to look for things that filled my cup during my day, experiences with patients or with mentors or with preceptors or with peers that brought me joy. And going back to something that has always brought me joy with teaching is building that relationship with a student and having that longitudinal connection and fostering a deeper bond over time. And I thought internal medicine did a really beautiful job of providing the opportunities to do that with patients. I was in a longitudinal core clerkship program, so I spent most of my clerkship time in the clinic rather than in the hospital. And I was able to develop really long-standing relationships with patients that year. And that was super impactful for me and made me want to go into internal medicine.
I really appreciate that reflection. Thank you for responding to my psychoanalysis.
No problem.
And I apologize in hindsight. Brent, my understanding is that you are the inaugural director of the School of Medicine's Career Advising Program. The many initiatives, resources, and career exploration activities that have been introduced to students over the past 6 years have been designed by your team. As you were building this program and as you continue to build this program, what are the most important ingredients for successful career advising?
I would say first, I want to acknowledge that I was the co-director. And so my partner, Heather Whalen, was instrumental in building things. And building was a process. The role did not exist before. So we had to learn a lot about what was working and what was not working. We met with a number of groups of students. We met with faculty who were specialty residency advisors. We heard a lot of things that were not working well, like the website. And we also understood that there were parts that were very, very solid and just needed some improvements, like the AAMC Careers in Medicine framework that was already underlying the career advising that had happened prior to us starting this role. When we began, we had to do a lot of things. I mentioned the website. It was not optimized for phones or small screens. It was also very outdated in terms of content. We had to set expectations, particularly with some parts of UCSF, like the admissions office, so that students who are coming into UCSF had clear expectations about what UCSF offers and some parts of UCSF that might be more challenging. And we also realized that we had time. There were the two of us, and that we could try to take on a few projects each year with the hope that we could understand how these new ideas were working or not working, and then hopefully move towards improvement.
And Kendall, what resources, whether it be conversations, shadowing, role models, clinical experiences, podcasts, information videos, did you rely on to figure out that internal medicine was a good fit for you?
Oh, gosh. I mean, honestly, what resources didn't I use when I was trying to figure out what specialty to pick? I think that a lot of the ones that you mentioned, including clinical experiences, I mentioned the clerkship program that I was a part of, working with a primary care physician in internal medicine was super impactful for me in recognizing that I wanted to be a doctor like my preceptor in the future. My most impactful research experiences have been with primary care physicians as well in internal medicine and were really influential for me. Both my research mentors are also women in medicine and women who do clinical work and research. That was also impactful for me in seeing myself in the future or what I would want my life to look like. I definitely used the AAMC Careers in Medicine to jumpstart me and get a sense of what specialties might be good ones to keep on my list. It also mentioned med peds and pediatrics and family medicine. So clearly I was in this bucket of being some kind of generalist or a field that offered a lot of variety. And I would say shadowing was also really impactful for me. So I used a bunch of different things, and I would recommend that future students do the same too.
A theme that I hear from you is identifying where you naturally fit into. And I definitely want to emphasize that. When I was going through this process in medical school, I knew I also really like to teach, and I really like to spend a lot of time with patients. And I found myself oftentimes more interested in their childhoods than I did in their blood pressure readings. And the reality is, I think everyone is going to be very different in that, and very much so looking internally and asking yourself, what kind of role do you naturally fit into, both as a friend and a partner and a child and a whatever it is, whatever space you find yourself in, and finding what field in medicine emphasizes those things within yourself. Brent, Kendall mentioned the AAMC Careers in Medicine framework. What is that, and how can students use it to explore their options?
On the surface, the framework is pretty simple. It's starting by knowing yourself, then exploring specialty options, then choosing a specialty, then applying to residency. But each step presents its own challenges. And the Careers in Medicine website provides a lot of tools. There's a survey to explore one's own values and interests. There are the specialty profiles. There's over 200 specialties represented on the website. There's a tool to understand and diagnose the root causes of indecision when we're thinking maybe there are many options that would work for us, but I don't feel comfortable making a choice. And then there's all of us in the career advising program that are hoping to provide support along the way.
How can students identify their career values and align them with potential specialties?
We have one-on-one office hours every week. And sometimes it seems that students want me to tell them what they should do, and I don't think that's my role or my place. We ask students to take some of the careers in medicine surveys during orientation at the very beginning of medical school, the ones on values, interests, and skills. And these questions sometimes are a little bit hard to answer. Like one of the questions is, do you like reading EKGs? How would you know how to answer that question if you've never done that? But they're a starting point. And then what I encourage people to do is stratify their values and goals by priority. There are some things that are must-haves, some things that are good to have, some things that would be nice but not really important. And then try to map those high priority values and interests onto specialty paths. And the Careers in Medicine, as I said, provides a lot of tools so that students can see and clarify for themselves what they value, but they can also see what specialists in each field see that they value too. And so you can see on the website if there's similar or good overlap between what I want for my career and my future and what specialists are saying that they have.
Kendall, this may be an abstract question for you at this point in your career, but how have you identified your career values, and how did they influence how you explore specialties and ultimately how you chose internal medicine?
That's something I've been thinking about a lot, particularly going through the application process and the interview process for residency and trying to identify aspects of not only a program that would feel like a good fit, but ultimately a career and a field that would be a good fit for me. And I would say that I have realized that identifying my values is definitely an iterative, ongoing process rather than a finite, one day you have identified all your values and the day before that you hadn't. It's definitely a process rather than an event. And that also has helped me relax a little bit about identifying my values. It gives me a little more patience and time with myself to figure that out. Values that I have identified so far that are on my list of really important things for a career and a future are continuity, like I mentioned. I think that really encompasses the longitudinal relationship aspect of patient care that is super important to me. That's also true for my education work. I want relationships with my students, with my mentors and my teachers. And I would say clinical variety, both in terms of diagnosis or organ system, and also in terms of acuity. I think I'm leaning more toward primary care at this point, but I still love hospital medicine and working in the ICU. So variety, continuity are both really important to me. And then I think something that really stood out to me about internal medicine was the curiosity that all the folks that I've met in internal medicine brought to the table, and their love for learning and their passion to keep going to morning conference to noon conference, because there's always something to learn or to keep exploring. The last thing that I would add to my answer is really to focus on your values, your independent reflections and experiences and goals for your career, specifically to minimize how much you're focusing on what others are doing, because it's very easy to do that in an environment where you're all going through the same courses at the same time. You're all trying to figure out your specialties around the same timeline, more or less. And it can be very easy to get caught up in what other folks are doing. But the most important thing is what's important to you and what is going to make you happy, not only right now, but for a whole lifetime, and how you can best serve the field. So keep going, focus on yourself, and identify those values, as hard as it is.
Before, Kendall, you had mentioned deciding between med-peds or peds or internal medicine. Brent, what kind of advice would you provide to someone who feels torn between multiple specialties, especially ones that in many ways are quite similar?
So first, liking many options is a good place to be. It's much better than the opposite. Some people sometimes tell me that they like nothing. And if there are truly multiple, absolutely equal options that would lead to professional satisfaction in the future, then you really can't make a bad choice. Flip a coin, you will have a great career. But it's more likely the case that the options are not exactly the same. And so going back to what I had mentioned earlier, which is what are the really important things for someone for a future career? How do these show up in some specialties versus others? that can be a way of trying to decide between many good options.
What about money? You know what I mean? What about how early do I want to get up or how hard do I want to work? Thinking about those lifestyle factors, how do you speak to students about how they should weigh these considerations?
Work is called work for a reason. There are some parts of work that will not be thrilling every second, but we spend a lot of time at work. And most people will have a professional career that's going to last decades. And so if so, it's worth taking the steps to make sure that the job is what you think it will be, including how it can support our lives in terms of salary, in terms of vacation time, and how some aspects of the job might actually somewhat hinder it, like time on call or after hours or holidays or expectations, those type of things. And in most cases, these factors are not secrets. There's tons of information about what to expect from different specialties. And so it's sort of the same exercise, understanding yourself. What are your life values and goals? How do those weigh against your professional priorities? And what's really, really important? Does our work give us the things that we really, really prioritize? And hopefully relatively little of the things that we really don't want, that have few deal breakers.
What are some ways students can explore different specialties during their clinical years?
So I think the challenge about the clinical year F2 at UCSF is that it doesn't have every specialty. And even for the specialties that are in the clinical years, it's a somewhat narrow slice of what's available in the specialty. So it's worth thinking, if someone had a great experience on their clinical rotation, does that reflect the specialty as a whole? Or are there other factors like I've worked with a great team that might be present sometimes, but not always within a specialty? It's also something that's a bit of a big ask, but I think is important to do, is to use the time that remains that's not required time in the curriculum to explore. There are the electives or KICSs, there's white space time. It is a lot to ask to use time that people could be spent doing anything else like sleeping to try to explore specialties, but it can be really, really valuable and important to make sure that someone has seen what's out there and really feel like they're on the path that would be best for them.
And are there any pitfalls students should be mindful of when exploring and choosing a specialty?
I think there are a few, and some of them come up somewhat commonly. One of them is narrowing too early. It's great that many people enter medical school with some really good idea of where they want their professional future to go. And it is also probably the case that most people entering medical school have not been exposed to all the different things that someone could do with a medical degree. And if someone really is focused on one area, then it could be that later, at a time when it would take much more to try to develop a competitive application, for example, to switch interests. I think another pitfall is the concern about competitiveness. Sometimes I hear that people feel like strong competitiveness can dissuade someone from choosing a specialty. And I would say that is a mistake. If you got into medical school, you can do this. A third one that I was thinking of is letting extrinsic factors override your own values and interests. Sometimes people tell me that they feel pressure from others to do certain things. And the question that I try to bring up is that really what you want? Because if you feel the same way as the person who's telling you how to feel, that's great. But if that doesn't really represent you, it's your life, your career, and you know what's going to make you professionally satisfied.
And Kendall, thinking about advice that you would give to students who are trying to figure out what specialty to choose, what kind of things come to mind when thinking about how you would talk to a first or a second year about that process?
I am thinking of things that I was told and either did or wish I listened to, and things that I am continuing to tell myself now. And I would say advice that I would give to anyone who is not sure what specialty they want to do is really just to give yourself some grace and some patience. That would be my first thing, is you have time, and at the very minimum, time to take a breath, to take a second just for yourself, to recenter yourself and recognize that you've done a lot of hard work to get here. It's a long journey, so you have to pace yourself. The second thing I would say is really to go back to something I was talking about earlier, which was to find things that fill your cup, find things that really bring you joy, and whittle those experiences down to the key moments that really are the key experiences that lead you to your values, which is much easier said than done. Think of the last time you smiled in the clinical space. What made you smile? What was it about that experience? How can you find that again? And then on the flip side, also considering what are some really difficult experiences you've had? What made those difficult? Are there specialties where you can either minimize those types of experiences or cater your career to maximize your experiences that bring you joy and happiness, and either minimize the difficulties or more realistically have more tolerable difficulties, which is a very individual process to figure out.
I just wanted to again thank both Kendall and Brent for sharing their thoughts with us today on how students can explore these career options and choose a specialty. I have one final question for each of you as we wind down. Kendall, what might our listeners do to foster belonging for others here at UCSF?
I'm really glad we're talking about this. I think something that has helped me feel welcomed into spaces, and something that I try to do to make others feel more welcome, is just to really lead with curiosity when I'm meeting someone new, or even when I'm meeting someone who I know extremely well, just to approach them with genuine interest. And I think that you can welcome people into your corner. And if you have the space and the capacity at that time, you can also offer yourself to join them in their corner. I think that medicine is a really long journey. It's a really wonderful field, and it can also be really tough at a lot of times before medical school, during medical school, afterwards. So I think recognizing that we all have something to offer, we all have something different to bring to the table, and just to continue to be curious about what that is and how you can support others in that has been really important for me throughout medical school.
And Brent, what might our listeners do to foster belonging for others here at UCSF?
I think that would be making an effort to bring people in. As I said at the very beginning, I didn't think that I had a place here. And my parents are not doctors, they're not academics. And a lot of people helped me. They saw something in me. They reached out to me. They believed in me when I didn't. So I think now it's time for me to pay that back, and in some ways pay it forward. And hopefully people can truly feel like they do have a place here.
So in conclusion, today, we have learned about how students can identify their career values and goals, explore options, and choose a specialty. Thank you so much for joining us on this episode. Don't forget to tune in to the other episodes in this series on medical student success.
Thank you for listening to The Bridge, and please look for more episodes in our series. The Bridge is brought to you by the UCSF Academy of Medical Educators Innovations for Funding in Education program. Our hosts are Alvin Glanga and Dr. Nakai Corral. Our production staff are Dr. Eric Hung and Valerie Jones. Our sound engineer is John Oliver. Our music is by Duke Hugh, Wax Roof, Mabanwa, and Les Imprimes, courtesy of Big Crown Records.